Hello, my name is Alex Harmers. I'm a plastic surgeon with clinics in Cologne, Germany and Malaga in Spain. I'm going to talk about BBL surgery, safe BBL surgery, and the advantages we have with the MÖLLER workstation, the combination of the Liposuction Pro Plus and the VibraSat. First, it's very important to provide a good tumescence to our patients. The combination of this pump with a max of 1000 cc infiltration volume per minute and the vibration provides a very fast and safe tumescence infiltration. It's very important to provide sufficient tumescence solutions to all the areas and give enough time for the tumescence to work. Now we are going to start with the TLA infiltration here, about 300 cc of TLA per minute, the vibe up to 5000 vibes a minute, and a pretty fast infiltration, separating the tissue. The next step is always a 360-degree liposuction of abdomen, love handles, bra area, lower back. We have a wide range of cannulas to choose from. We can use some rapid extraction cannulas or normal Mercedes cannula for the liposuction. I myself prefer a Mercedes, a double Mercedes for the liposuction in combination with the VibraSat Pro, so it's easily connected. We can easily change the cannulas during the procedure. The liposuction tube is connected to the handpiece directly, so while doing the liposuction we can choose and change the cannulas without any problem. We are changing now to liposuction. We are starting with this Mercedes cannula connected, and with vibration, with our power assisted, we are going to do the liposuction right now. After the liposuction, to prevent any irregularities in the liposucted area, I like to add on some equalization with a 2.0 basket cannula compared to a 1 to 1.5. It's wider open. I have a wider opening of the basket area, so I can easily separate the tissue and provide a very nice equalization of the abdominal area, of the thighs, areas where irregularities may occur after a normal liposuction. Now we are going to achieve a smoother result, get rid of any mini dimple we may have produced with the liposuction. We are doing some equalization. I'm using this 2-point basket cannula connected to the VibraSat, and now we are going to loosening up the tissue, breaking the fibers. When it comes to fat infiltration and the combination with the VibraSat Pro and the Liposuction Pro Plus, we have about 6-meter infiltration tube. So this tube can be easily connected to the fat container. It goes through the pump and directly to the VibraSat Pro. So we can use a simultaneous expansion of the tissue and infiltration. I personally prefer a 300 cc infiltration rate per minute with about 5000 vibes. But this is something each surgeon needs to feel safe with the volume he's providing per minute. I myself, with 300 cc's per minute, can easily infiltrate within 15 minutes the volume I normally use on my buttocks. So if I'm infiltrating like 1200 cc per buttocks side, we have about 4 minutes of pure infiltration time. Let's give it a take. We change the infiltration side and the entrance hole. So we have 6-8 minutes. With 15 minutes, we easily are augmentating 2.5 liters on the buttocks totally. It's fast, it's safe, it's replicable, and it's really lowers the operation time, so we have less risk of thrombosis. We have a better take rate of the fat. It's fast, easy, safe, and provides a better result for our patients. Now starts the fun part. We are going to fill in the hip dips from anteriorly. We are using a 5mm 1.5 basket cannula, and we are going to infiltrate about 200 cc's from anteriorly now. So when it comes to fat infiltrations, it's important to separate the tissue and open the tissue to fill in the fat. So in the old days, when we were injecting with cannulas and syringes, we were pressing the fat in with a lot of shear stress and opening the tissue just with the pressure of the fat. So we had a lot of shear stress to the fat cells. Now with EVL, expansion vibration lipofilling, we're opening up the tissue with our vibrating basket cannula, and the fat is falling into this open space, so there's hardly any shear stress to the fat cells and a better fat cell survival. Additionally, using the Liposuction Pro Plus infiltration pump, this pump is pretty similar to the pumps used in dialysis, and we have very little pressure to the cells. We have hardly any shear stress, and we have a very, very good fat cell survival. Now when it comes to BBL, some colleagues and patients may be afraid of fat embolism. So it's very important to follow the important rules. Patient positioning is very important. We place our patient in a jackknife position, legs down, head down, the buttocks are the highest point. I'm just infiltrating upwardsly, so I'm always staying in the safe area. It's nearly impossible to inject into the muscle. It's very important not to inject into the muscle, just inject the fat into the subcutaneous tissue where it's riskless. Now we are going to start with the EVL fat infiltration to the buttocks. Patient positioning is very important. We are in a jackknife position with our patient, so when we are injecting from above or from beneath and just injecting upwardsly, there's no chance that we inject fat into the muscle. Now we are doing with ultrasound control the EVL infiltration to the lateral buttocks and the hips. Okay? My patients should sleep in the prone position for about 6 weeks after the surgery. Restricted sitting for the first 6 weeks. We provide some cushions for our patients to sit on, and it's very important to always use compression garments. My patients use some compression garments for about 6 weeks, day and night. I recommend to use them about 23 hours a day, so once a day take them off, have a shower, give some hydration and scar care to our patients, and then use some compression garments like this. It's important to compress a little bit more the waistline. I add on some compression belts for the waistline. Depending on the donor areas, we added on some thighs or arms. It's very important to give a good compression to the donor areas as well, so we can use extra arms or whatever area we treated.